Heart disease is really scary because it's associated with sudden death. This country spends billions of dollars trying to prevent it. We've developed the concept of risk factors, those things which we think and know contribute to heart disease. Some of them are pretty clear and we know that they are important, such as smoking, high blood pressure, diabetes, and obesity. A major risk factor is cholesterol, and it's a little bit less clear because there are many different types of fats in the body. There's at least 15 different types of what we would call cholesterols. And it really depends upon which blood test your doctor orders to determine how healthy or unhealthy you are. Total cholesterol, which is what the words say, total of all the cholesterols, the good and the bad, is probably the most meaningless and the least helpful in terms of deciding about your health. But I want to go beyond the big five, because you see, in order to do a really good job of protecting the patient's health, I think you have to look at other things also. For instance, vitamin D has been found recently to be very important in terms of cardiovascular health. Low vitamin D makes you much more likely to have a serious heart attack than if you had high vitamin D. Homocysteine has been around for quite a while and I think is terribly important. It's a normal factor found in all our blood streams, and yet it is the carrier of oxidative radicals, which causes oxidative damage and inflammation in our blood vessel. High homocysteine is clearly associated with increased risk of heart attacks and strokes, and certainly should be checked for. Inflammation is related to that, but inflammation may be related to many other diseases, such as rheumatoid arthritis, ileitis, colitis. Any form of inflammation actually raises your risk for heart disease. Heavy metals is something that not many people talk about, but it is part of our pollution problem, causes greater inflammation and damage to our blood vessels and arteries. Therefore, these other factors should also be part of a really good medical evaluation for your cardiovascular health. They are done in my office on a routine basis.